Hey there, my name is Gabe Allende. I'm a nurse practitioner student. I'm here to perform a partial head-to-toe assessment of my son Giovanni Allende. Okay, here we go. All right, I'm going to first check the the musculoskeletal exam of the upper extremity. I want you to put your hands out like this for me so I can palpate your hands. I want you to go ahead and do some range of motion for me like this. Great. And I want you to put him down for me. I want you to put your arms up above your head. And I want you to cross your arms behind your back, behind your head. There you go. And I want you to bring your arms down and I want you to hook them behind your back as if you're trying to touch your shoulder blades. Perfect. And bring them down. Okay, and relax. I'm going to go ahead and I'm going to check his deep tendon reflexes now. Start with stay right where you're at. Stay right where you're at. Start right there. There. Check and brachioradialis down. And triceps. Relax your arm. Relax your arm for me. Great. Now I'm going to check your patellar reflex. Check the Achilles reflex. And slide back for me, laying down. Take your socks off real quick. And I'm going to go ahead and check Babinski on him. Great. And go ahead and come in and go ahead and have a seat again for me. Moving on to the leg portion of the exam, I'm going to go and check for pertibial edema and pedal edema, which I don't see any. We're going to go ahead and check for leg, knee, and hip mobility, movement. So go ahead and lay down for me again, slide back. And I want you to go ahead and bring your right leg up, bending the knee. Perfect. Checking for knee flexion as well as hip flexion. I'm going to bring the leg up here. I'm going to check for external rotation of the hip and internal rotation of the hip. And put the leg out in front of you again and bring the other leg up, bending the knee and flexing the hip. We're going to hold leg up here. I'm going to check for external rotation and internal rotation of the hip. And go ahead and put your leg out in front of you. While we're here, I'm going to go ahead and check for straight leg raise. I want you to bring the right leg straight up to about here and back down. And the other leg up, left leg up to about here and back down. About 45-degree angle there. To confirm, I'm going to go ahead and bend both legs a little bit for me right there. Perfect. I'm going to go ahead and check the popliteal pulses. And I'm going to check for the posterior tibial pulses and the dorsal pedis pulses. Okay, put your legs out in front of you for me. I'm going to go ahead and observe both legs for symmetry, pallor, varicosities, any lesions, and so forth. I'm going to go ahead and have Giovanni go ahead and sit up for me. And put your feet back down on the ground for me. And I'm going to go ahead and have him stand up facing me. I'm going to go ahead and check his back now. I'm going to walk around the patient, checking for shoulder symmetry and height, for scapular symmetry as well, and hip height as well. I'm going to go ahead and check some range of motion as well now. I'm going to have you bend forward and touch your toes. And come back up, and I want you to go ahead and bend back as far as you can. And back to center. I want you to tilt your upper body towards me. And other side. And back to center. And I want you to rotate your shoulders and only your shoulders. Twist early, there. And other side for me. And back to center. I'm going to stand behind the patient here, and I'm going to go ahead and observe his spine for scoliosis, any lateral deviations of the spine. Go ahead and bend forward for me. And come back up, and he does not have. Fantastic. Okay, go ahead and have a seat for me. I'm going to move on to the neurological portion of the exam now. Okay, I want you to tell me what day it is today.
March 1st. March 2nd.
Okay, what day of the week? What day of the week?
It's Saturday.
Awesome. What'd you have for breakfast today?
Eggs and bagel.
Awesome. Okay, we're gonna check for your upper and lower extremity strength. So I want you to put your arms straight out in front of you just like this. I'm gonna push down your arms, I want you to resist. And I'm gonna push up and I want you to resist. Awesome, and relax. I want you to curl up just like this. Okay, like you're doing curls. I want you to resist me pushing. I want you to resist me pulling. Awesome, and relax. I'm gonna go ahead and put some pressure on your legs here. I want you to try and bring your right leg off the ground, or as I put pressure, go ahead and lift and relax. And other side, and relax. I'm gonna check for strength here on resistance and straighten the right leg. Go ahead and relax. And the left leg, and relax. And reverse and put the leg a little straighter. And go ahead and try and curl the leg. And the other leg, try and curl and relax. And go ahead and go straight back, lay down on your back. There you go. And I want you to go ahead and try and straighten your foot. Both feet, perfect, and relax. Okay, go ahead and sit up for me. All right, you flat on the ground. Okay, we're going to go ahead and check light touch and light pain sensation. Giovanni, this is the sharp and this is the soft. Can you tell the difference?
Yes.
Okay, great. I'm going to do it on your lower extremities as well as your upper extremities. You're going to close your eyes, okay? And you're just going to tell me what you feel, okay? Close your eyes for me.
Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft.
Awesome. Okay, moving on to vibration with the tuning fork, my 256 hertz. I'm gonna have you close your eyes again. I'm gonna put the tuning fork on. You're just gonna tell me if you can feel the vibration. Ready?
Yes. 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 Yes.
Awesome, and relax. All right, we're gonna check what's called proprioception. I'm gonna manipulate your fingers and your toes, and you're gonna tell me with your eyes closed if I'm pushing them up or pushing them down, okay? So hands just like this, perfect. And you close your eyes for me and tell me which way we're going.
Up. Down. Up. Down.
Big toes.
Up. Up.
And a little toe.
Up.
Other side.
Up.
And relax, fantastic. Okay, let's go ahead and have you stand up. I'm gonna have you stand right there and I'm gonna have you turn around and back up a little bit for me, and you're gonna walk towards that wall, just observing your gait. Go ahead. Perfect. And go ahead and turn around and face me. Now walking back towards me, I want you to walk towards me with heel to toe, just like this. Heel to toe. Awesome. And stop right there. And I want you to walk on your toes and walk on your heels. Awesome. And stop and relax. I want you to go do a knee bend all the way down and all the way up and hop a little bit for me. Perfect. Okay, great. Come in forward and face me right here. Okay, you're going to stand with your feet together. I want you to put your arms straight out in front of you. I'm going to have you close your eyes. Go ahead and close your eyes. Now, keep your eyes closed. I'm going to push down on your hands, and I want you to find your way back to the same position where they were. And open your eyes. Awesome. Relax. Okay, awesome. Have a seat for me. Okay. We're going to do a rapid hand movement here. I want you to put your hands, palms up on your thighs. I want you to kind of flip them up and down, just faster and faster, and relax. Good. Now I want you to do a little bit of a hand and nose movement here. So I want you to go ahead and use your right finger here, and I want you to touch your nose and touch my finger with it. So do that. And then keep going, touching your nose, touching my finger, wherever my finger goes. Keep touching your nose. Back to your nose, to my finger. And relax. Fantastic. Now I want you to go ahead and pick up your right heel and rub it down your left shin. Now I want you to pick up your left heel and rub it down your right shin. Perfect. And that's it. And that concludes my short physical assessment. Thank you.